Hello to all of our viewers on DATV. This is the Ombudsman's program, and my name is Diane Welborn, and I am the Ombudsman, and I'm going to be your host for this evening's program. I'd like to begin by saying that we are going to have a special feature of one of the programs of our office this evening in honor of Veterans Day. So first, I want to offer a thank you to all those who have served, to all of the veterans that might be viewing this program. And we hope you will take note of the information that we're going to provide to you this evening, because if it's not direct, if it's a benefit not directly relevant to you, it may be to one of your fellow veterans, somebody you know, or a family member. So with that, we'll get started because we have a lot of information to share about this relatively recent program, which is serving veterans specifically and their families. So I'd like to continue by introducing our long-term care program director, Lawrence Chip Wilkins. Good
Good
evening,
evening,
Chip.
Diane.
Thank you for being here.
Oh, thanks for having us.
Looking forward to hearing from you. And then I'd like to also introduce to our viewers Jimmy Gillespie, who is our veteran Medicaid to Veterans Association Transition Coordinator and has been for some time now. Welcome, Jimmy.
Thank you, Diane. Thank you very much for having me. I appreciate that. And that is a mouthful, isn't it?
Yes, yes, it is. It definitely is. And we are thankful to have this program, and we're going to tell you why in the course of this program. And as always, if you have any questions, this is a call-in program. So you're welcome to call Dayton Access TV, and they will put the number on your screen. And if you have a question or a comment that you would like to make, please feel free to do so. And because we're doing this via Zoom, we will get your questions and comments in the chat, and we will do our best to respond as time allows. And if for some reason we don't thoroughly answer your question or address your comment, you're always welcome to call us at the Ombudsman's office, and I'll give you the number later in the program. Well, I'll do it now. It's 937-223-4613. And I'll do that again in case people weren't watching with a pen. So I think I'd like to move next to talking a bit about what is our Medicaid to Veterans Association Transition Program. I'd like for Jimmy and Chip to give us a bit of background about what this program is and what we are actually doing for veterans, and then we'll move into how we got started doing it. So take it away, gentlemen.
Good evening. Yes, thank you, Diane. I appreciate that again. I would say that this Veterans to Medicaid, or actually it's the Veterans on Medicaid program. It should actually be called Veterans off Medicaid, because that's what I do.
Yeah.
I get veterans off of Medicaid and get them into the VA. It started about 11 years ago in 2013 in Stark, Summit, and Cuyahoga counties. And it really picked up steam there, became law in 2016. And basically, again, it's just one of those things where it's inherent to me to want to help veterans, because being a veteran myself, you always want to be somebody who wants to help. So again, Chip, I don't know if you want to add to that.
Well, that is it. And it's in addition to making sure that veterans are able to take advantage of the veteran benefits. There are specific facilities, nursing homes, that we try and help veterans transfer to if need be. Once you go through the qualifications of the program later on, the end result of qualifying is that you're in a nursing home, and that's why you need the Medicaid, or that's why you were using Medicaid to help pay for the cost of nursing homes. But the VA can take that cost over, but they require that the veterans participating in the program go to a veteran certified nursing home. And they go in and do a lot of extra checks to make sure it's not just up to snuff for Ohio, but for their uh, own oversight at the VA administration. They want to make sure that the veterans are going to really good quality nursing homes, and ultimately that is where the veterans that do participate in the program end up.
Right.
Yes. Thank you very much for that overview. Um, Jimmy mentioned that this started 11 years ago as a sort of a pilot in a couple of counties, and then has now moved across the entire state. And Jimmy, I'd like to ask you, is this a program that's happening all across the country, or is this something unique to Ohio?
I would like to say it's unique to Ohio, but I can't.
Okay.
As much as I like to say that, this is the best kept secret for veterans in Ohio. I can tell you
Yeah.
that, especially for elderly veterans or veterans in need of long-term care. It is the best kept secret. So shh, don't tell anybody what we're doing. But
Uh,
again, the interesting thing is that yeah, all 88 counties participate. We are I believe it's happening in, from my understanding, California does it as well as Texas. Um, but again, the one that I'm focused primarily on is the state of Ohio, the wonderful state that we live. And again, this is a law, so it is something that Medicaid actively pursues in order to get these veterans connected to services through the VA. So, really interesting, best kept secret to the veterans in the whole state of Ohio, right here. So listen, pay attention.
Yeah, that's why we're wanting to do this program, to get the word out so it won't be such a secret. And we're going to touch on reasons why as I think we go through the rest of of our program tonight. What in your opinion, gentlemen, gave rise to this initiative? What's the reason behind a program that helps veterans transition from a nursing home where their payer source is Medicaid to a VA facility?
Can I take this one, Chip? It's kind of a
sure.
softball.
Sure.
It's a nice loft there, Diana. I like how you just tossed it up to me. Money. It's to save the state of Ohio money. We are saving Medicaid millions and millions of dollars by moving veterans, transitioning veterans into long-term care facilities that are contracted through the VA. The VA covers the cost of their care. We pull them off. Again, I mentioned earlier, we should be called the Veterans Off Medicaid program. But naturally, we want to move those veterans into a federally funded program and get them out of a state funded program to save the money for the state and disperse that to people, again, the most needy of them all, right? Let's just make sure that that happens, the worthy poor, basically. And again, we assist in that by helping these veterans get connected to services that they didn't know existed. So two plus one.
Yes.
And
Thank
Diane, I
you.
would add to that, one
Please.
of the just more amazing aspects of the program is that the individuals who were on Medicaid in the nursing home, when the VA comes in and they realize that they qualify for this benefit from their service, uh, then the veteran gets to keep their money. So Medicaid was saving a lot of money by getting the VA involved. This is something the VA wants to do. And in the process, the veteran who has an income, let's say Social Security's coming in or disability payments are coming in, normally, if they're in a nursing home, they have to turn that income over to the nursing home before Medicaid starts to pay. Well, in the Veterans on Medicaid program, the veteran gets to then keep their money. They don't have to turn it over to the facility. And it's life changing for a lot of families. There are so many stories we could share about how uh, folks who were on Medicaid in the facility, they gave all their money to the facility except they get to keep $50, but they didn't know how they were going to care for their spouse at home. And they hear about the program, they get to keep the money, they don't have to worry about their spouse at home, and it just is such a relief for those families. And it happens time and time again.
True.
Yes, and that's one of the best benefits. And we'd love to hear some of those stories, and we will talk about other benefits in addition to that. Is there a particular level of disability that is required for admission to a VA facility?
The very simple answer to that question is yes. The magic number is 70% service connected disability.
Yeah.
There are some other things that fall into play here. We won't get too far into the weeds. There's a thing called individual unemployability, which is 60%, and it's usually like a broken back or something that prohibits somebody from earning an income. But again, 70% is basically our magic number. That's when we're actually beginning the transition process. So the cut and dry simple of it is 70% will get you in the door, and that's where we come in to help.
Okay. And are the veterans that you are speaking with and helping to transition to another facility, are most of them already at 70%, or has their level of disability just kind of been neglected or not reviewed or not updated in some time?
There's that all of the above, Diane. I like to
Okay.
yeah, so I like to say yes to all. Um, so the veterans that I primarily help are those that are not yet 70. We help to get those veterans up to 70, and that's a pretty elaborate process. The cut and dry of that is that there's 5 agencies that are involved with this Veterans on Medicaid program, and us being one of them as the long-term care ombudsmans. We're also joined by the Ohio Department of Aging. We're joined by the Ohio Department of Medicaid, the Department of Veteran Services, the VA, of course. And then again, we help these veterans who aren't yet quite 70% get connected to these services. So I'm basically a big crayon lover, Marine, hoorah. We like to connect the dots, and that's what I'm doing. I'm helping these veterans who are not yet 70% service connected get to that magic number to make that transition happen. So 70%, that's it.
And Jimmy, or Chip, do most of the veterans that you are encountering as you're looking for them to see if they're eligible for this program, are most of them aware of their level of disability?
For the most part, Diane, most veterans, when you ask them if they are service connected, they will be able to tell you. Unfortunately, we are dealing with people in long-term care, many of which who have lost their faculties. Luckily, they have family members that are involved. Those family members work with me. We're able to tell. And the interesting thing is when we start to work with a veteran on Medicaid, the facility that they live in or currently live in, or if they're living in the community, the only information we really need to find out is what their social security number is, okay, when they served. And we can look into the VA records to see, if there is a service connection for them. So most of them do know that they are service connected. Again, our job is to step in, bridge that gap, help them file claims through VSOs throughout the lower half of the state, and work them through that transition process to get the VA to cover the cost of their care.
Okay, we have a caller, but I have one question related to what you just said, and then I'll get to the caller's question. And that is, you mentioned that this is a state law and that it exists in all of our 88 counties. And just wanted our viewers to know how many of those counties you cover, Jimmy, and so that people will understand what is your territory, so to speak, in the state of Ohio.
Yes, ma'am. Yeah, my territory is actually the bottom half of the state of Ohio, from Columbus to Portsmouth, from Dayton to Marietta. I cover 39 counties. I've made relationships with pretty much all those veteran service officers, either through trainings that we've performed or a lot of miles on the car. As you know, you're the one that signs my dispersion checks, right? So yeah, there's
Yeah.
that. There's a lot of miles on my vehicle, but a lot of wheels spinning. But again, doing what we love to do, driving out to see these vets in these long-term care facilities. I cover about 1,000 facilities, Diane, to be honest with you, about
Yeah. Okay.
so there's that. So 39 counties to answer your question specifically.
I think that's
Diane,
helpful for viewers to know. I'm sorry, Chip. Please go ahead.
sure. I just wanted to throw in there that so many times when we are meeting veterans for the first time in facilities, commonly you will find veterans who really, for a variety of reasons, have not gone back to have their disability reevaluated. And many times we'll meet someone who was in Vietnam, back home now, and lived their post military life and are, for one reason or another, in need of long term care. Well, they have not been back to be reevaluated for their disability. And when they left, they may have been 20% uh, service connected disability, but now they have diabetes or Parkinson's or heart disease, and they don't think that any of these can be connected, any of these diagnoses can be connected to their service. But in when you're talking about the Vietnam War or conflict, when there were boots on the ground in Vietnam, there was exposure to Agent Orange. So anything that the veteran may have now in terms of a diagnosis, that it may be connected to the service they provided in Vietnam. So it is certainly always worth investigating and trying to determine what can be done. And then Jimmy can work all kinds of magic and working with the physicians to get that disability percentage up to date where it should be. And that's what they do. And I only bring this up because so many times veterans think that their disability is well below 70, but in many cases, that can come way up pretty quickly.
And I'll piggyback on that real fast, Diane, just to say this. We are currently assisting veterans who have dementia for a secondary, okay, this is a secondary service connection to hearing loss. So we are able to connect. There's documentation out there on the VA side that connects dementia to hearing loss. So if you have a veteran that has hearing loss and they now have dementia, chances are you get them connected to me and I'll get them connected and probably up to 100%. I'm working with several family members who are, have that scenario. And again, Chip briefly touched on the Agent Orange issues, and again, that would be a whole nother show, I think, because we can just talk about presumptives all the time. But if you were in Vietnam, you were boots on the ground, and you were exposed to Agent Orange, there are several illnesses which are presumed to be caused by that. And if you have a presumptive, it automatically fast tracks you into getting higher service connections rather at a rapid pace. So again, I mean, a lot of information that we could cover. I know we have a lot of limited time, but yeah, if anybody has any questions, again, fire them away. We'll answer what we get.
Well, we have one now, and then I'm going to come back to that determination of disability. One of the questioners who's called in says the caller is a veteran. Thank you for your service. And how can the money that the person is entitled to from veterans disability be redirected to his family? So
Well,
how does that work when a veteran decides that they want, because this is always a personal decision. Nobody has to move if they don't want to. But if the veteran decides they want to move to a VA facility, how does the how do the benefits that they would have been receiving now go to their family or to them? How does that work, Jimmy?
So
Or
basically,
Chip?
when we transition a veteran, when I, again, that's the heavy action word, right? The verb transition. When we have VA push the button that says we're going to cover the cost of this veteran's care transition, right? We push that button. When that happens, the VA can do anything they want. Or, I'm sorry, the veteran can do anything they want with their money. The prerequisite is that they have to be in a VA contracted facility. Now, I know there's going to be the questions of where are those? There's several located throughout the great state of Ohio, and there's probably not that many in the county where you live. That's a VA thing. Again, I can't get too deep into the woods on that one. But once we get the veteran connected and moved into a VA contracted home, they can do whatever they want with their money. Medicaid likes to do this thing called a 5-year look back, where they're going to look at every little rock and took, who'd you give money to? Why'd you do that? The VA doesn't care. Spend your money. It's your money. You've earned it. You're entitled to it. Spend it. And if you want to give it to your family, if you want to give it to a cousin, we don't care. Just do what you want with your money. Feed the local economy, however that looks to you. We would love to help you do that.
Okay, that sounds good. Now, back to that determination of disability that Chip spoke to, that many don't know because it hasn't been done in some time. Maybe you can inform our viewers about if there are veterans that are living in nursing homes, or even veterans that are needing in-home care. How do they go about having their level of disability redetermined if it hasn't happened in some years?
The easy question, the easy answer to that question is contact your county veteran service officer. Um, in our county, Montgomery County, Kim Frick, of course, over there at Montgomery County, and all her veterans that are eager to assist, because that's what veterans do. We love to help. We're helpers who love to help. Contact your local county VSO. If you're in a long-term care facility already and looking to transition into a VA contracted home, I'm your guy. Call me. I'll, like I say, get that big red crayon out and start connecting the dots. As long as some veterans don't even know that they have these conditions, and hypertension is one of them, right? Hypertension is now a presumptive. We talked about that earlier. A lot of people have high blood pressure. A lot of veterans do. A lot of veterans came back from Vietnam and acquired type 2 diabetes. That's also a presumptive now. So get with your local county VSOs if you're in the community and you're not looking to transition into long-term care. But if you're looking to go into long-term care or need to relocate into long-term care, we're your people. Chip, myself, we'll help you get to that transition level and make that happen as soon as possible.
Anything to add to that one, Chip?
Well, all of these can go down rabbit holes, but the important thing is if a veteran wants to know what their current service connected disability is, and it hasn't been done in 5 years or more, they should absolutely contact their veteran service office, whatever county they may be living in, and they will make that happen. Mm-hmm. Then they set up a evaluation with a doctor, and they get that completed, and then ultimately by the third or fourth visit, you will have a full appreciation of what your new disability percentage is, and it'll be much more accurate. But it's something that veterans, particularly as there's aging that takes place, the longer you live, the more you really do need to make sure you're staying current and getting that evaluation done, if not yearly, every other year.
Okay, and this all takes place then by the VA medical personnel. They're the ones that are doing this, or inform our viewers if it's different than that.
It would be different than that. There are times when the VA will step in. So we have a lot of veterans that are immobile. They can't really leave the facility. So we actually have the VA in some instances come to them, or they get shuttled to the VA for that. But there's several companies that actually help our veterans get connected to services. They're third party because the inrush of claims has skyrocketed over the recent years with all the presumptives that we're talking about and things along those lines. With that happening, they have outsourced this to like three different countries, QTC, I'm sorry, companies, QTC, LHI. These are all third-party schedulers, basically, that will schedule your CMP, so compensation and pension exams. They will schedule those with you, so they'll be the ones that connect the dots and get you the appointments to the doctor's visit. They're the ones that set those schedules, and they're the ones that will be contacting the veterans or their family members to say, "Hey, we're trying to get this veteran set up for this meeting. We heard you claim post-traumatic stress disorder. We're going to get you in contact with a psychologist, and they're going to do some, examinations, so on and so forth." So it is something that's not necessarily handled by the VA per se, because actually that's a conflict of interest. The VA itself is actually, you can't ask a doctor at the VA to say, "Hey, can you connect my post-traumatic stress disorder?"
Right, right.
Because again, they work for the agency which you're actually making a claim against, and it becomes a really hairy situation. There are times, however, we work around that. So again, easy answer is, yeah, the VA has other outsourced companies that they use to schedule those exams for compensation and pension.
So any veteran that is contacting their local VSO office or us
Mhm.
contacting you, Jimmy, is should not be surprised that there's a third party that's going to be involved
Yes.
in helping to reevaluate their level of disability.
That is correct. And here's
Okay.
the thing, all the VSOs in every 88 counties are they're well versed in this. This is what they do for a living. They help veterans get connected to services through the VA. I help them get connected to the right VSO. So yeah, the VSO will guide them to what that process looks like if they need that.
Wonderful. We have another caller who wants to say that this caller is a veteran. Again, thank you for your service. And the caller has multiple disabilities. How is the care for these disabilities prioritized? I assume the caller means in the VA contracted facilities that we're talking about, or you can speak to it either in nursing homes, our current standards, and VA as you wish.
I would actually pass that with me again. Prioritizing care that is done through care planning at the facility. I'm trying to wrap my head around the entire question as I heard it, but in my scope, prioritizing care now, prioritizing disabilities, that's a VA issue, right? They're the ones that say 70% for post-traumatic stress disorder, 30% for your left knee, 10% for your tinnitus. What? 10% for your tinnitus. So they're the ones that are doing that. They're the ones that are prioritizing those disability claims and that. So if I understand the question correctly, Diane, if not, please, either walk me or go to Chip, please. So,
Well, I do, Jimmy, I think that part of it is the caller may want to be reassured too that even though you may have a 10% disability for one diagnosis and 20 or 30% for another diagnosis, that is just part of the VA vernacular that they use. It's their terminology, but it doesn't really impact how the individual is cared for at the facility. If they have 10% tinnitus or 20% diabetes,
mhm.
the facility should be giving 100% effort to every diagnosis that you have.
That is a great answer, Chip. That is a home run, brother.
Good. Thank you
Right.
for that. The also wanted to ask, is there anything else that our viewers need to know about the determination of disability? It's very complicated, and it seems like most of the veterans, particularly the ones living in long-term care facilities who need help with Medicaid to support their life there, um, have not had these evaluations done in some time. So I just, want to make sure the viewers have a good idea about how that determination process goes.
Yeah.
How long does it take when you talk if you find a veteran and they're interested in making a move from where they are now to a VA certified facility? How long does it take, and what are the steps involved in that? So can you walk us and our viewers kind of through that, please?
Would love to. So 70% again being that magic number, and the want to move. It's called a resident initiated transition or transfer. Those residents have to want to leave the facility they're in. Otherwise, it's not going to do you a lot of good to file all these claims with the VA and then have all that money go to Medicaid. It's going to be waste of your time, waste of their time. But if you want to transition, again, contact our office. I have transitioned veterans, met them on a Monday. By Wednesday, I had them placed in a different facility. Now that's somebody that's already 70% and wants to relocate. This is how fast we can make this happen. In the other side of that, filing claims, the VA has hired tons and tons of what they call raters, raters, raters. These raters are the ones that go and they're the ones that look at these exams. So the VSOs at the county level file the claims. These people are at the claims level looking at the claims and saying, oh, these dots don't connect. Or, yes, you have post-traumatic stress disorder. You were a jumper in the Army in Vietnam. Yeah, here's your 70% service-connected disability. So those claims can take a while. That process, I have veterans that have been and had on the books for about a year. I've had veterans that have gotten qualified and transitioned within 90 days. So it all depends on how many claims we're filing, what the claims are for, the process, reevaluations, and things along those lines. So every person's going to be a little bit different. But the big takeaway from this is if you're in long-term care, you want to move to a different facility where you can keep all your veteran contracted VA service connected money, contact our office. Just please give us a call. We love to help.
No, very good. Anything else to add on that point, Chip?
Well, I think it's important that every case is unique, and though it's hard to pinpoint a length for all of them, I mean, on average, you see it about a 90-day window to get into the VSO and then get into have whatever evaluation by a physician needs to occur. The more uh, diagnosis that you want to connect to your service connected or your service, the more specialists you may have to see. You don't see the same doctor for tinnitus that you do for, say, diabetes. So there's all kinds of just life occurrences. You got to go to different specialists that will take a little bit of time, but it is so worth it. If you get to the end of it, you're 70% or greater, and now you get to keep control of your funds that you've worked your whole life to make sure we're there when you need them as you retire.
Mhm.
Yes. Thank you. Thank you very much for that. And yes, it all depends upon what you're trying to diagnose, who you need to talk to do that, of course. Thank you for that clarification. I think one of the things that has surprised us in our office a bit that we want to share with our viewers is that a lot of our nursing homes where veterans live currently, because of their disabilities, are not aware that the individuals are veterans, that they're serving. So somehow along the line of their life and their disability and their admission to a nursing home, that has kind of dropped off the screen. And Jimmy, I'd like to have you and Chip say a little bit about, how does this happen and how do we find veterans um, uh, to reach out to with this program and to inform them about the benefits, which we will get to in a few minutes. But how are we finding them, and why do nursing homes not know that their residents are veterans?
It's a great question, Diane. I mean, that is a very handsome question. If I had to say, I would say they're just not asking the right questions. Some of them don't ask any questions at all, right? They just, are you on Medicaid, or can you be on Medicaid? And Medicaid's it. We'll get you on, here, have a bed. So they don't know the right questions to ask, and again, it isn't just, hey, did you serve, or when did you serve? That's the questions they should be asking, but they're not doing that at admissions. That's when it should be happening, and they should be acquiring that information. On our side, we receive a big list called the Paris file, which is basically a national list of all people who are receiving public assistance. So PA, public assistance, and then the rest is an information system. On that list are veterans who are, so some of the nursing homes do capture or acquire that data. They then provide it to a large reporting system such as Paris file, and then it gets back to us, and we say, hey, we have these veterans, we're going to connect to them. The flip side of that is there's not always consistency in that list. That list comes to us, it's like 90 days old. Some of the veterans have moved on either through attrition or moved on and moved back into the community. In that moves or in those relocations, we lose veterans. So I'm out here basically visiting nursing facilities and having other ombudsmen across the state visit facilities and ask people, hey, are you a veteran? And then when you come into contact, that's where we're getting like really nitty gritty, and there's only one of me in 1,000 facilities. So again, it's daunting to say the least. And there's a lot of veterans out there who could really benefit from this. This is why I said it's the best kept secret in the state of Ohio.
And that's one of the reasons that we're doing this program tonight, is so that if viewers know a veteran that is not aware of this program, they can hopefully inform them. Well, we have two callers here that have questions. The first is a veteran from the Vietnam action that became drug addicted, and wanted to know if we could make any referrals for help with that particular treatment for that particular problem.
Well, I would say yes. And here's the issue. A lot of Vietnam vets came back to a country that didn't necessarily want them, right? It was one of those times where we look back and now as a nation we regret. And the answer, again, if you have a substance use disorder that attributed to your connected to service, they have a thing called duty to assist. I'm working now with a veteran who was in the Navy, who was he had substance use disorder. He was an alcoholic. The Navy knew he was an alcoholic, and gave them no services, didn't provide them with any hey, try this or try that, or no AA meetings and things along those lines. And the service, the VA actually has a duty to assist. So I would say that if you have, if you're a Vietnam veteran, you are struggling, call the VA crisis line. And I'm sure we can probably find somebody to put that across the bottom of this crawler, or provide it to you. If you call our office, I'll be happy to help you through. But if you're struggling like that, call the VA crisis line. They will help. And if you're not in the VA, I can't stress it enough, get enrolled in the VA. The more people we get involved, the larger the pot grows, the bigger the kitty. So yeah, I wish you well, and hopefully you get the best. But again, to answer your question, get a hold of the VA crisis line. That would be my advice to that caller.
And Diane, to add to that, just the caller, if they can't get through to a crisis line or they have any issues, call us 937-223-4613. We will do anything and everything to help. They can ask for Chip or Jimmy, and we will we'll make sure that we get them the information for as many referrals as they may want, because we want to make sure that uh, our veterans get the services they need.
And I just wanted to add a clarification about our telephone system. When you do call our office for assistance, be aware, please, that we will ask you to leave a message so that we can have the right person return the phone call to you. So please don't be frustrated by that. It just helps us get the right person connected so you don't have to talk to several people in our office before you're with the right one. Another caller has called in to ask about the satisfaction of those that have transferred to a veteran service certified, sorry, veteran certified facility. And what about their satisfaction rating and the follow-up that we do with them about that?
Well, here's the big kicker of this whole program. So in a Medicaid facility, if a veteran is laying there in a Medicaid bed or participating in Medicaid activities through the long-term care facility activities director, if they're there, they're only getting $90 a month from, they should be getting $50 a month from the Medicaid and then $40 added to that because you're a veteran. You should be getting $90. When you transition into a long-term care facility, the minimum amount of money you can make, 70% service connected like myself, is $1,800 a month or so. Okay. So you're going to be making $1,800 a month versus getting $90 a month PNA or personal needs allowance. So you get to keep all your money. So satisfaction is directly tied to the amount of money a person gets to keep. 100% service connected veteran can be making in the area of $4,000 a month tax-free money. In some instances, they are making more money than the administrators of the facility where they work or live. And it becomes one of those things. So I think satisfaction is directly tied to that. They get to keep their money. But at the same time, for the veterans that I'm helping, I would say 90% of them are happy with where they're located. The other 10%, again, you can't please everybody all the time, right? There's that. But for the most part, getting to keep all that chunk of change, that really comes in handy and you can help the family again. So it's all good stuff.
And Diane, I will add to that just as kind of anecdotal evidence. We did have a veteran. She transitioned from a nursing home to one of the VA facilities in Sandusky. And what was fascinating was there had been a bit of a period of time where she did not visit with family. Turns out when she got to Sandusky, one of the first things that she did was invite her family to come and see her. The reason she didn't want them in the nursing home was she had a negative stigma with nursing homes, but uh, she didn't like the family seeing her and such. I guess a vulnerable position, but at the VA facility, there was a sense of pride with them coming to a veteran focused facility. And it was certainly something that lit up in her that caused her to then want to invite her family. And this was many years ago, but it's still one of the best memories I have from the program. And it had nothing to do with money, ironically, even though she got to keep her income at that point, but it was being able to have pride in where she was at to bring her family in.
That's a heartwarming story, and of course, money is important, but
Sure.
there are other benefits as well, and maybe both of you can help let our viewers know about some of those advantages. I would think that there would be therapies and other health benefits and specialties in a VA facility that may not be available in the average nursing home. If you all would like to mention some of that, and then also the just the benefit of living in a facility with a with people who have shared the experience of service and being cared for by those who appreciate that service. So maybe you all can speak a little bit to that so our viewers can understand how it may really be very different in addition to the financial benefits to the veteran, which, since they're in a facility, would primarily be going to their families.
True. So yeah, you're talking about a big wheel, right? That's the biopsychosocial, events, being a social worker, right? I did my internship at Georgetown Veterans Home, which was a blast, and to see all these veterans, um, there's definitely the advantage of, that connectedness. But some veterans won't talk to anybody unless you're another veteran. That's why it's so easy for me to go in and talk to these veterans. And then when veterans start to talk, it's almost like at times you think we're speaking a different language. What was your MOS? When did you serve? What was your rank? Who were you with? And people are rapping off like MWSS 171. You're like, what was that? Marine Wing Support Squadron 171, Iwakuni, Japan. You never forget who you serve with. But
Sure.
then you have the camaraderie that's involved, right? Of who you're there with. And you get the shared experiences and the storytelling and the embellishment of those stories, and the camaraderie that's created is just so unique among veterans. And again, I salute every veteran that I see. I salute their family. I salute, thank you for your service. I mean that from the bottom of my heart. I do what I do out of love for this country and love for the veterans that I serve. And to see them happy and to see them come out of their shell and be able to talk to other veterans is really a unique experience. So yes, thank you for that, Diane. Appreciate the question.
Well, it's also healthy,
It is
and health building, and yes. And Chip, did you have something to add before
I
I?
did there are some uh extensions of service that occur in the VA that may not make it in the nursing home. For instance, they do what's called respite uh physical therapy, and what that is um we've all heard of family or friends or us going through physical therapy, and usually at a period of time it has to end because usually uh, Medicare, Medicaid, or some insurance company is saying that's enough. Well, they still do daily bedside um, therapies, and in the VA, it's much different because they typically go the extra mile, and you get a different type of continuation of therapy. Not to mention the whatever mental health crisis they may be dealing with. When you are doing any kind of therapy that may include the group, it is so much better for the veterans with other veterans to talk in groups because no one understands that better than a veteran and what you've been through, and then can give you some life experiences they've been through that may help them. And they really understand because they have been in the same position with their lives on the line for their country. So we see a lot of unique options for treatment and therapy in the uh, VA setting.
Thank you. Thank you. I
Okay.
appreciate that. You've touched on a bit earlier about it can happen a move or transition from a nursing home to a VA facility can happen very quickly. It can take a little longer depending upon determination of disabilities. But do the the VA facilities that we are working with, do they have usually a lot of availability to accept incoming residents?
Yeah, and one of the more interesting things about it is a lot of these facilities offer veterans private rooms and things like that line. Again, it's different at each facility, and there are the answer to the question on everybody's mind, where's the nearest one to me? There's four in Montgomery County, right? There's one in Preble, one in Miami, one in Shelby, of course, Maya and Green. But the bulk in the region that we serve in the Dayton region are in Montgomery County. Now, each one of those offers a different scenario for their veterans, but they are all pretty much ready and available to help a veteran, take in a veteran. The other thing I want to add to Chip, what he said about the therapeutic aspect of it was being a VA contracted home offers a little bit more oversight too. We have these contractors who are in there. There's nurses and social workers that walk through those facilities. They're almost a regulatory agency, which can actually shut that thing, not shut the facility, but turn off the money from the VA if necessary, if there was, a grievous act or anything like that in the facility. So there is additional oversight in there as well, which also plays into, what we're doing as ombudsman. So the team effect of working with the VA for that is pretty cool.
Yeah, it's good.
Yeah.
Do we think now that this program has been around a little while, and I know this is directly a part of your job responsibilities, Jimmy, but do we think now that more VSOs are aware of this option for their veterans who are living in nursing homes?
Yes, ma'am. And to answer that succinctly, so every September since I've been here, and this has basically been 2 years, so last September and this September, we provided training. So the Veterans on Medicaid program went to the VSO training, which is all 88 counties send all their VSOs basically to Columbus. You'll never feel safer in a hotel, I will tell you that. There is that. So, except for the one time where there was actually the FOE as well, or whoever else was there, the police officers. But long story short, we provide training to all these VSOs. So they now know myself and my cohort, Chuck Calasina up in the upper part of the state, who does what I do down here in Dayton, he does up by Cleveland. Needless to say, we're providing training. We're becoming more familiar with these VSOs. They know us by face. They call us when they have problems. I have a relationship with pretty much all the ones around us in particular, because again, it is the region that we serve. So shout out to all my VSOs. Appreciate you doing what you do. But ultimately, it gets us to the point where we, if they have a problem or have a veteran that they need to get connected, they know to call our office or, of course, Chuck's office up north. So, we are making that headway.
Wonderful. We don't have a lot of time left. So I would like to ask if I'd like to ask a couple of questions in the short time we have left. I'd like to ask if there are some concluding remarks that either one of you would like to make about something that maybe I haven't asked. And then I'd also like to ask, how would you suggest that our viewers can help us get the word out to contact us if they think they know a veteran that can use our services? So I'll toss it to Jimmy first and then to Chip.
So,
Thank you.
so I always fall back on the prohibition, right? If you want to make something that doesn't stick, make it illegal, right? So don't tell anybody about the program. Don't tell a soul. It's a secret. Please, by all means, tell everybody you know. This program exists and is geared at helping some of the most deserving people in our country. We celebrate the day today for them. I can, I'm 99.44% sure that everybody knows a veteran. I'm pretty much sure that you may know a veteran in need, and I'm really kind of sure that you might know remotely a veteran in need of long-term care. Any of those questions, any of those needs, Our office can help. I never turn a veteran away. So if you have a veteran in need, we have access to resources in our office that are the microcosm of helping veterans. And if you need anything, by all means, put our number out there, Diane. Again, if you can,
I
call
will.
us, email us, reach out in any way you can. I will be happy to assist.
Yes, our number again is 937-223-4613. And we welcome your calls. I will say you'll be asked to leave a message, but we return our calls promptly. That's one of our goals in our office. So, Chip,
Right.
how would you like to help us conclude what has been a very short amount of time we've had tonight? It seems like it goes by quickly.
It does. It flies by, but I think it is important for anyone viewing this to know that when we throw around the term nursing home and folks are in nursing homes, and usually the vast majority of people we come in contact with had no intention of being at the nursing home. A life event, emergency occurred, and it brought them to usually a hospital, then a nursing home, sometime for a short period of time, sometimes longer. Whatever the case may be, and however long it may be, uh, reaching out to an ombudsman for help uh, with any veteran is always an option. But please, for the viewers out there, if you know of veterans who may be in long term care, let them know that, hey, call the ombudsman. There may be a program that can help you. And we, by no means, this is not anything that we benefit from as an office. We do this because we want the best for the our veterans, and that is precisely, as Jimmy was saying, why we all do this. This is just to try and make life better for our veterans, and that's all that the program does. It's everything it does, but it's what we want. It's why we're all working where we're at, because we love to help individuals and particularly veterans.
Thank you. We appreciate that. I want to again thank all of the veterans and the families of veterans who also serve in their unique way. I'd like to thank the callers that we've had this evening who brought some very good questions to us. Like to thank my guests, my colleagues, both Chip and Jimmy, and to thank all of the viewers. And please help us spread the word about this good program that we're trying to assist people with. So thank you for viewing this evening, and thanks to all the veterans.
Thank you.